afternoon, all our viewers. Welcome back to S-Class. Remember, S-Class social media show that runs both on Facebook, YouTube, and also on Instagram. S-Class, you can go and look for us on Facebook, YouTube. Just put in S-Class 56 and look for us. And remember, today's show has been powered by Universal Care for Africa Foundation, which is a non-profit organization, and it supports communities in Africa when it comes to equipment, research, and also supporting health workers in that people's health be well in all over Africa. So Universal Care for Africa Foundation, we are live on the Universal Care for Africa Foundation Facebook page. You can go drop your comment, ask a question. Today on the panel we are discussing the impact of COVID-19 on people's mental health. And today on the panel I have Dr. Tim Patrick, who is a clinical officer and also a psychiatric doctor. Then also I have Mr. Kugonza Martin. He's a doctor, Dr. Kugonza Martin, who is a clinical officer also, and is a pediatrician, works here at China Uganda Friendship Hospital. So today on the panel, they're going to basically we want to digest the impact of COVID-19 on people's mental health. But before we go into how it has affected people, we want first of all to know what COVID is and how best has it been managed in Uganda. So we are going to start from my right hand side. I'm going to start with that. Briefly tell us about yourself, and also then before we go to the question.
Yes. Thank you very much, Sam. My name is Tim. I like it to keep it simple. The titles are there. There are very many. But as of now, we're in a COVID period, and I'm going to talk more about the COVID and its impact on the general population and also the people that we had. In Nakuru, I work with, of course, I'm employed with by the ministry, and I'm deployed in Nakuru Referral Hospital. Most of the people know it as China Uganda Friendship Hospital. So here, basically, we've been with the teenagers. All those teenagers below the age of between 10 years and 24 years, they have been passing through our hands. But due to the pandemic of the COVID, of Corona, I've been now I'm in the section of the COVID. So that's where I'm based as of now.
Thank you so much, Dr. Tim. Then it comes to Dr. Martin. Briefly tell us about yourself.
Okay. It's so good to be hosted on this show. So I'm Martin Kugonza. I work with China Uganda Friendship Hospital as one of the clinicians. I'm also a member of the task force, which is on standby for treatment of COVID here in China Uganda Friendship Hospital. Yeah, nice to be on the show. Thank you.
Thank you so much, Dr. Martin. Then, briefly, Dr. Tim, tell us when it comes to COVID-19 in Uganda, how has it been managed according to your side?
Okay. As far as COVID management is concerned, the Ministry of Health set out a policy that for all those people who are tested positive must be isolated in a center. And there are so many centers within the country. Yeah. And within Kampala here, the basic, the centers that were designated by the government as treatment centers, you have Mulago, you have China Uganda Friendship Hospital, you have now we have a gazetted place which is Nambole.
Nambole, yeah.
Yes. And then other private facilities that have been allowed to be able to manage some of these COVID patients. So as long as somebody is tested positive, somebody is supposed to be isolated in one of the isolation centers. Okay. However, as we see, the numbers have become many. Not like before, the numbers were very few. We had a few numbers, but now almost on a daily basis, we have on average over 500 new cases, new confirmed cases, on average 500. So that's a very big number, and it is a strain onto the management. Yeah. But for all those ones who are tested, they have a point of reference. That is, they have a place or designated place where they can be able to seek treatment and advice as per the COVID is concerned.
Okay. Thank you so much, Dr. Tim. Now, when it comes to Martin, do you think COVID-19 has been managed very well when it comes to Uganda? Because at first the government said that we're going lockdown when we got our first case in Uganda. When we went into lockdown, truck drivers coming in and people coming in, yet we were on lockdown. Then management of COVID patients, then the numbers started increasing. So do you think government has done its best to manage COVID-19 patients in Uganda, and why are people getting COVID and the yet government took us on lockdown? On my side, I believe we were locked down and we wouldn't have got COVID.
First of all, I would love to appreciate the Ministry of Health, the government of Uganda, for the quick action that was taken. COVID-19, SARS COVID-19 was discovered in China. That's when they reported the first case, I think in December. And then according to the world, it was declared a pandemic where all countries at least had a case in around March 11. And then in Uganda, we got our first case, I think was on 23rd of March. That was through the persons who are the returnees from the other countries. This time it was one of the Arab countries. Maybe it was by transit or it was coming from there. So as soon as that was discovered, immediately the president put us on the lockdown. And according to Dr. Tim, what he had said, there were isolation centers, there were quarantine centers. By then, all the returnees were held in the quarantine centers for a period of 14 days as they are being tested. So the ones who turned out negative were let go home. The ones who turned out positive were diverted to the treatment centers. So the treatment centers, like I said, the Ministry of Health did tooth and nail to at least set up the COVID-19 treatment centers, at least in every region. And at least in every region, there was a place at least to carry out a test, or avenues in which sample collection can be offered, and then they would refer them to the nearby testing centers, maybe in the central business districts. Here in Kampala, we have around like 3. In the eastern, at the border point of Malaba, was a testing point in Tororo. In Entebbe there is one. Here in Kampala, like I said, around like 4 or 5. And then it came at a point whereby the Mulago Specialized Hospital, now to be, or it is, was being finished up, and they put up at least some quite number of beds, about like 150 to 200, to take care of the patients who would be ill or diagnosed of COVID. However, differentiating who should be admitted and who should not be admitted was the case, because by then we were admitting all persons who test positive. But later on, as of now, we've realized that we would love to admit only the people who have signs and symptoms, who return to be symptomatic. So going into lockdown, first of all, was a fear for most of the people, and what we had heard from the other countries, because all other countries were learning and doing what they had done, because they had gone into a lockdown for all the other countries. So we copied from that, because when you go into a lockdown, you minimize to the spread of the illness, and you try to learn and discover and get to see how the disease how the disease is behaving. So with those points, as we continue in the discussion, I think the government did something.
Okay, thank you so much, Dr. Martin. Now, when it comes to protein, how can somebody know that he or she has COVID?
Thank you very much for the question. From, I think by now,
Mm.
everybody is aware,
Mm.
at least that there is something called COVID.
Yeah.
Now, to be able to differentiate COVID from other symptoms, or rather other diseases or other conditions, the key is testing. When you test, you are able to know whether somebody is having COVID or it's another condition which is causing symptoms which are similar. But basically, these are the things that we normally we look at when we say somebody is having COVID. Some of the people that are diagnosed, that are tested, some of them may not experience any symptoms. So those ones will be asymptomatic, so they don't have any symptoms. But for those ones who have symptoms, this is how they can be able to present. Number one, they can have a sore throat. Two, they can have a headache. Three, they can have a fever. Four, they can have chest pain. They can have a running nose. They can have difficulty in breathing. They can also have general body weakness. And this is not attributed to any other physical conditions. Because now we have seen people who have gone to clinics. They have tested them for typhoid, they say it is typhoid. They treat them for typhoid and the typhoid is not getting better. So at the end of the day, when you test them, you find actually they have COVID instead of the opposed to the typhoid that they have been treating. So basically, that is how you are able to tell that somebody with those symptoms, somebody is having COVID. But there is one thing that I've actually just remembered and missed out: loss of sense of taste and smell. Many people come with only that. They don't have a fever, they don't have what, everything is fine, but their taste has changed, which is abnormal. They can't smell anything, whether there's a perfume in the house or whether there's something which is bad with a foul smell, they don't smell anything. And many people out there have that. And those ones, whenever we've tested those people who have had that, they have ended up having a positive result. And so the person is COVID positive. So that's how we can be able to know that this one is COVID positive and the other one is not COVID positive.
Now, there is something that Dr. Martin talked about of now only admitting those ones who are critically ill or who need to be on oxygen. What if I test positive and at my place I have very many people I stay with? What do I do?
Okay, we have the, thank you very much. We have the surveillance teams in each region, in each division. For example, we're in Nakawa here. Nakawa has got a surveillance team. Now that surveillance team is due to when somebody is tested positive and the home has from maybe 5, 6 people in the house, or even 10, 15, because in our society here, usually we all stay in the same home.
Yeah.
So this is what usually happens. One person, if you tested positive, you first be picked out. Then the surveillance team goes on ground to have the contacts whom you have been staying with tested. You may realize that out of all those ones, you may be the only person testing positive. So you are taken away from the isolation center to the isolation center so that you do not spread. Okay, yes, the others are contacts, but you could be at a point when you are spreading the disease. So getting you out and then leaving the rest the other side is very, very important. Then, in case you find maybe like 3 or 4, maybe 5 people in a home, actually, that's all, the whole home is infected. Usually, the surveillance team can be able to advise on how best we can be able to handle the people. Either we have them into the isolation center, or that is the treatment center, or we can be able to guide them on how to get a service from where they are.
Okay.
Yes.
Thank you so much, Dr. Tim. Whoever is watching us live on Facebook, live on YouTube, Remember, we are discussing the impact of COVID-19 on people's mental health. And also, remember, this show has been powered by Universal Care for Africa Foundation, which is a non-profit organization which support different countries in Africa in that they access good health care, and also in providing equipment which can easily support people in Africa. So Universal Care for Africa Foundation, you can look for them on Facebook and look for them on their website, which is Universal Care for Africa Foundation.com, and also you can look for them on their YouTube channel, which is Universal Care for Africa. Then we are live also on Facebook, which is S-Class256, and we are discussing the impact of COVID-19 on people's mental health in Africa and the whole world in general. Remember, the first case which came here in Uganda came in around March. Then after they had to go on lockdown, so numbers have gone on increasing. The president has come out and said that numbers are increasing. Minister of Health, WHO, they all come out and tell people, wear a mask, wash your hands with soap and also running water. Take your time and wash your hands. Don't only wash your hands when you visit the toilet or you go to ease yourself, but also when you go in public places. Be with a mask. Use sanitizer every time that you be. Please make sure that you social distance yourself with different people. Yes, Dr. Martin. Dr. Tim talked about that you can be in different people and you test positive when you guys were many. What is the science behind if we have been like living in a group and I turn out to be positive, yet my colleagues are negative?
No, that's an interesting question. At the back of our mind, this is I should say a new disease to the whole world that a lot of research is taking place. Some of the researches that are coming out are one person who is tested positive for COVID-19 in an infectious stage without a mask, without a facial mask covering the nose and the mouth, and is not hand washing, can be a potential spread of the disease. Because this disease is airborne, that person is able to transmit to about 3 people next to him. Now, when we test that very person, one person, at that particular point of time, we do not know when did he catch the illness initially, and when was he in his infectious stage. Okay? So, I believe the practice of him being tested and is found positive, and his other colleagues are negative, I may say, are negative, maybe for reasons A and B. Maybe they were in an aerated environment, and maybe it's not a closed room. There are quite a number of factors to consider. Maybe they were doing hand washing and they did not touch the soft parts, like said before, the eyes, the mouth, and the nose. Maybe they were at a social distance. However, the chances that people who have been in an enclosed place, windows closed, close to themselves, at one particular point, one of them will test positive. But the fact that you cannot relay a point that I was maybe at place of work, among the people I was with, I was tested positive and my other colleagues were negative. It's not justifiable. That's what I can say about it.
Thank you so much, Dr. Martin. Now, Dr. Tim, like Dr. Martin said, there is that possibility. Like according to you, the way that you have seen things moving. Because I've seen very many people complaining, why am I positive and my colleagues are negative? Like they don't see the science behind. So what's the science behind? Like how does it come? If you can add on what Dr. Martin said.
Yes, thank you very much. Well, as of now, we cannot really tell much of the science behind. However, we try to copy something from the HIV. HIV, we've had, I think you've heard about the so-called discordant couples.
Yeah.
They are together, but one person is and the other one is not. So, as of now, I cannot really, we don't have really so much of the science to be able to explain that, because people have been together, one person got, the other did not get, okay? But the chances, there are so many chances that somebody is not going to, somebody may miss the infection. For example, I've seen families where you find out of a group of 6 in the family, 2 people turn out to be negative, but the other 4 are positive, and yet they stay in the same house. But if you look at the daily activities of the other 2 people, they are not in touch with the rest of the family. For example, you find a maid is negative, but the rest of the family head, the next, that is maybe the wife, and the other children, for them, because they mingle together, they play, they do what, but the maid will be at a distance. But when you test all of them, find the maid is negative. These ones are positive because of the closeness, okay, that these ones can be able to predispose somebody. Actually, the more somebody stays there, the more likely somebody is, or the more dangerous it is that the person is going to contract. So you may find that, yes, everybody is there within that particular room, but the time they spend with each other is less. These ones will just come and go maybe to their room. These ones will come and just eat food and then they disappear. So the time that they have with the rest of the family, though they are together, is less. So the chances become minimal. Yes, the exposure is there, but the chance that he or she is getting the infection is less because the person is spending less time with the person who is infected. Okay? So if somebody is somebody is spreading the disease, probably walks in and he goes to his room, he's not touching anybody, and more so, somehow, people are sanitizing, somehow. So it is also helping, okay? It is also helping to reduce the risk of course, the risk is there of contracting the virus.
Now, something I want you to explain to us. They are telling us we shouldn't shake hands, which we used to do before,
Yes,
no giving
yes.
hands, which we used to do before. But we are only covering our mouth and the nose. So why are you stopping us from shaking our hands? Yet you are saying that we shouldn't. It's more saliva, and also maybe if I spit on you, you can get the virus. Why are we not also wearing what we call gloves, in that we don't get these viruses?
From the time we started, I've noted, sometimes I note with concern, of people who have decided to put on gloves everywhere they are going in order to prevent the COVID-19. Because we do know that when you have that droplets, droplets which are infected on surfaces, like on door locks, on surfaces of the tables, maybe on laptops, on our phones, and so forth. So people usually they touch very many objects.
Yeah.
And when they touch very many objects, some of these objects have got the infection is there. So they can carry that infection to you. So when you shake somebody's hand, and the person is infected, it's going to have that, you are going to have that onto your other hand. However, as you may agree with me, most of the people, when they are alone, they put off their masks.
Yeah.
And when they put off their masks, the first thing they do is either touch the eyes, to touch the nose, because very many people pick their nose. They touch something from the nose that is itching, they do at least they do something. So in that, you are transmitting the infection. They don't wash their hands. Yes, though we say that people are supposed to be able to wash hands, sanitize. Some of them don't. The sanitizer itself is expensive.
Yeah.
So we say, let us use at least soap and water. Now, instead of using soap and water, people don't even do that. So if you're going to be able to greet somebody, you never know at what stage he is.
Yeah.
You may greet a person and the person is infectious. Okay? At that point when the person is spreading the disease. So you end up getting the disease from him through a handshake. So avoiding handshake as much as possible, avoiding handshake as of now, and sanitizing, that is the key. To use the gloves, because now that glove, unless, even if you put on the glove, you are supposed to sanitize, because you are not going to put on the glove and think you are just going to have it like that, because you are going to touch another surface. You are going to touch your phone, you are going to open the door lock, you are going to open the car lock, you are going to touch your computer, you are going to do something which I could say many people use. So in that, even if you put on a glove, it does not, yes, for you may not, it may prevent you from getting it, but you are spreading it to another person. You're spreading the infection to another person.
Okay, thank you so much, Dr. Tim. Now we're discussing the impact of COVID-19 when it comes to mental health, and also not forget to sometimes it's better to use a mask. Don't forget to wash your hands with running water plus soap. Sanitize, social distance. Don't be in overcrowded places. Then remember today's show has been sponsored by Universal Care for South Africa Foundation, and Universal Care for Africa Foundation they are supporting different countries in Africa when it comes to equipment and also sensitizing people, health education in different countries, and also doing outreaches, community outreaches. So, and also you can look for them on Facebook, YouTube. You can look for them on their website, universalcareforafricafoundation.com. Then also we are live on S-Class 256 Facebook page, which is a social media show, which is a social media page that gives information different to people who always spend most of the time on social media. So today we are discussing the impact of COVID-19 on mental health, and the experts are telling us. Dr. Tim Patrick is a mental health, is a psychiatrist, and also Dr. Kugonza Martin, who is a medical officer, both working at China Uganda Fish Hospital, and they are members of the task force of COVID in Uganda. So Dr. Martin, I want you to briefly tell us, when people got to know about COVID, like those patients that we are working on in ETU, which were isolated and they're getting medication, how was their mental health when they came in?
Maybe to talk about it more, if we go back when we discovered our first case of COVID-19, it was very alarming according to what we heard about other countries.
Yeah.
Most of the persons, or not most of them, but the superstition we had that majority of them who would contract COVID because it's a severe acute illness that affects your lungs and leads you to failing to breathe normally. It was very traumatizing because you would imagine death has come your way. So the persons who tested COVID positive, some of them were without any signs and symptoms, some were with signs and symptoms. Now in the ETU, the first bunch we got had no signs and symptoms suggestive of any respiratory illness. So it was hard for them to accept that they were positive according to the symptoms and signs that they had had on TV, they had read over the network and had on the radio. So most of them anticipated death to come their way. But luckily enough, in our country, we never registered any death until September, August, around that, maybe July, but around there. So the first cases we got, it was hard for them to believe. So they fell into depression or an acute stress reaction first before they got depressed, where they failed to accept that they were positive for COVID-19. Now, among them, lost businesses. They were deterred away from their families because of isolation for about 14 days. And after them being discharged, it was hard for them to be accepted back in their families and in their communities. They have lost literally everything. At one point, one patient asked me, for the time we've been here in this unit for about 14 days, because there are some whom would discharge after 30 days. because of the criteria of discharge. There's a criteria for discharge. So others will get discharged at least in less than 14 days, at least 14 days, and then others would go past 14 days. So it was hard for them to accept the environment how they were being treated. Everything was provided. We're looking after you, having lunch, breakfast, supper, but your family cannot get close to you. And the illness they're telling you about is to cause severe acute respiratory distress syndrome. You are okay, you're not going onto oxygen. That's the first bunch, the asymptomatic cases, which we got. Not until later on, when the disease started coming into the community, that is when we started getting patients who are tested positive for COVID-19 with other illnesses that compromise their immunity. And as well, COVID-19 among persons who are after 65 years of age. So all in all, mental health, I would sum it into three things: acute stress reactions, which have quite a number of futures that can be listed. Depression. I'll mention those.
Okay. So you talked about something when you say that they don't take the same time when they are getting treatment
Yes.
in ETU. Like, what brings all this? If you're saying there are those who would stay like a month, others would stay less, then others would stay more than that. What brings all this? Yet they have the same disease.
Now, our treatment here in Uganda and worldwide, it's guideline based. Researchers done. Usually for the disease, for COVID-19, from the time you tested positive, would believe within 14 days your body should have had the capacity, at least within 10 days, should have had the capacity to fight against that virus, because this virus is self-limiting. The body deals with it naturally because you have a defense mechanism. Your immune system is meant in such a way that it can deal with some illnesses, especially when they are viral. And this viral infection, the only treatment that you can attain is getting a vaccine against you, so that your body gets that memory against that illness to fight against it if at a particular point you get a reinfection, or your immune system to fight against it. So within a period of 14 days, we would believe it to have cleared. So for us to know that you're due for discharge, we would subject you onto the same test you had at first, which we call the polymerase chain reaction, real time, where we test the DNA or the messenger RNA of that particular virus, whether it's still present. So on the 14th day, initially, we'll discover that you tested. If we discover that the result is negative, then we shall repeat another test. That's 24 hours apart. And if we have two results that are negative, then you're due for discharge. But that doesn't guarantee you that you will not get a reinfection. We give you the whole package of put on a facial mask to cover your nose and the mouth, and then practice hand hygiene. Now those ones would stay longer than 14 days. That meant that the test after the 14th day was positive. So if then now that will give you at least 2 to 3 days apart before we obtain another sample. And in case it also tests positive again, we still hold on with you, because we believe that you'll be a source of infection if you go out there in the community. And by then, according to the standard of living, it is hard for someone who is tested positive to go and stay at home, because most of the patients we would get were active patients. They are people who are looking out for their families they have to go and look out for that daily bread.
Yeah.
So, and then you would not risk, so for example, saying that maybe they would adhere to the Ministry of Health guidelines, because you would imagine they will still break them. So by then as well, even though the lockdown would feel that they will get discharged and they'll go back home since there is no movement. But here in Uganda, with or without the lockdown, it seemed to be the same way. People were walking to town, people were walking to villages miles. So being locked down, it was actually stopping or regulating movement of vehicles. But otherwise, people were still going on with their same business.
Yeah.
Yes, that's what I can say.
Okay, thank you so much, Dr. Martin. When it comes to Dr. Tim, we have had different people saying that this COVID-19 is made for old people, aged people, not for youth or teenagers. Why do we have young, very many people thinking all this, that this COVID is for only for the aged people?
Okay, thank you very much. First of all, before I answer the question, I would like to supplement on what Dr. Martin had talked about. When we first had the cases, people were stricken with fear. Almost entirely, the whole country was stricken with fear. That how could we get this person? And who is this person? And everybody was very angry, especially with the details that they got of the person who got infected. So, first of all, it created fear. In one of the communities, an ambulance was dispatched at around 11 in the night to go and pick somebody who was suspected to be COVID positive because the person had a cough. So when the ambulance came, it came with the siren all through up to where the person was. And an ambulance at that time, to be heard in the night, everybody virtually got up. And when the people came in, the ambulance team came in, when we were donned in white, like they say they are going to the moon.
They spray whatever.
Yes. So they came to this person's house and they picked this person, and they took him to the isolation center for testing. What I can assure you is that nobody slept in that neighborhood. They talked till morning because they thought, how could they have somebody who was COVID positive within their community? So it had an impact on two people's lives, and you can see the fear that it generates. So a fear to such an extent that the whole community around were not able to sleep because they had to talk. They talked really up to morning.
Yeah.
Nobody could sleep. So you can see how impactful it is. Now, coming on to why people would rather think that the disease is not for maybe the youth, that age group, and it is only for the elderly. The disease does not segregate. First of all, COVID does not, you should be able to know that COVID does not segregate. It cuts across. However, we do believe that at least people at the extreme ages, their immunities can be compromised or are compromised. One, they can be having other diseases, other physical conditions, which can compromise the immune system. And when you have the COVID there with already compromised immune system, it tends to take away the elderly. However, in our centers, we do have even those ones who are children. For example, at least for us in our center, the least person we have had is about 5 years who tested positive from a family. So it does not segregate whether somebody is below the age or the person is above the age. Okay? So it's just information gap that the youth or the young people is not consistent with them. The information comes, but is not what? Consistent with them. Otherwise, the COVID does not segregate. It only depends on somebody's immunity. And we do say that those ones in extreme ages, it's because their immunities could be compromised. That's why it is affecting them more than those ones within that age.
The teenage age.
Yes.
And just not for you to forget that this show has been powered by University of Africa Foundation, which says that they support different countries in Africa. And it's a non-profit organization. They support different countries in Africa in that they give them equipment when it comes to health, training health workers, giving people information, doing community outreaches. You can reach out to them on their website, which is Universal Care for Africa Foundation. Their Facebook page is Universal Care for Africa. Then also you can look for them on YouTube, Twitter, and also other platforms. Then we're also live on their page, and we are live on S-Class 256 page, which is about giving information to people. So we're discussing the impact of COVID-19 on post-mental health in the world in general, but particularly we're focusing in Uganda. Then today on the panel we have Dr. Tim Patrick, who is a psychiatric officer, and also Dr. Kugonza Martin, who is a clinical officer. Both of them are on the task force of Uganda when it comes to COVID-19, and both of them have worked in ETU before. So Dr. Martin, like Dr. Tim said that the COVID-19 affects all ages, and the least person age that you have had in ETU was 5 years. Then when you look at different people who have different immunities in our country, there's like doctors always come out and say people with certain diseases shouldn't be exposed to COVID. Like, want to briefly tell us which kind of diseases that people have and they shouldn't be exposed to COVID-19. They should protect themselves as like mostly like be strict on themselves.
Okay, thank you so much. Now, among the diseases that we focus on that greatly cause immune suppression are one, being a cancer patient and you are on radiotherapy or you're on chemotherapy, having HIV and AIDS, and at least you're in stage 3, 4. If you're a person who is above 65 years of age, we would consider you to be immune compromised. If you're a diabetic person who is usually having tendencies of high sugar levels, if you're a person with high blood pressure, in children, would call out for children who are having malnutrition or nutritional deficiencies, and as well would focus more on persons who are on steroidal drugs or corticosteroids, and they are taking them on a daily basis. Among the many, those are the ones that would focus on more, and more so maybe in children, those ones with measles, and of course if you have had history of smoking, then if you're a TB patient and you're on treatment, or you just recently recovered from TB therapy.
Okay, thank you so much, Dr. Martin. Whoever is watching us, just go on our Facebook page and tell us mostly, like you can comment, you can ask any question. Remember, the show has been powered by University of Africa Foundation, and we're looking for those comments. We are going to read different post comments, and just go on the comment box then and ask anything. I'm going to read them after. So University of Africa Foundation is there to provide different information to people in Africa, and also support different countries in Africa by sensitizing health workers, by giving people information, by giving them equipment, and also doing different activities in Africa. So, like Dr. Tim, now I want you to now take us when it comes to people's mental health. Where is COVID-19 leaving people's mental health in Uganda or in the whole world in general?
All right. Thank you. The impact of COVID-19 on the mental health of people in Uganda and generally the world is universal, is the same. Now, it's a long-term thing. But first, I want to appreciate the health workers who are dealing with who who are in these isolation centers, who are dealing with patients who have tested COVID positive. The health workers actually are drained. I should start with them.
Okay.
Before I go to the rest. These health workers are there with these patients 24/7 until when they are discharged. It puts a strain on them mentally and physically. Putting on that white suit can dehydrate you because you sweat, and being in it for 2 hours can really, it has got an impact on you. Okay? So it has got an impact on both the health workers and the rest of the community. So even the health workers themselves, like I've said, it puts a strain on them. Health workers are not supposed to be going to their families because of the risk of exposure. Because you cannot be from the isolation center and then you just go home. Otherwise, you can be able to carry the infection from the ward back to home. So it has got an impact, okay, onto that. It is draining, first of all, physically and mentally and emotionally, okay? That is onto the health workers. So I want to thank all the health workers, frontline health workers who are out there treating patients who are COVID positive. Now, to the rest of the community. One, we have had death. And some of these death, it is taken the heads of the family. And when there is death in the family, that means that it takes away one person, or it takes away 2 persons. Organizing for the burial takes a lot of money to be able to organize, okay? First of all, there are mourners who come in. You have to provide them food. In the beginning, yes, we had, and we have, that if somebody is COVID positive and a person dies, the government takes over the burial arrangements, okay?
Yeah.
Now, there is that part. But now the part in the family, to be able to organize for the rest of the other people, financially, it impacts on them, okay? People have to think hard, what exactly is this? That, what are we going to do, okay? People end up having stress. People end up having depression. But the most of it is that when somebody is lost, there is bereavement, okay? And people take time because the disease, how people are lost is within a very short period of time, whereby it gives you less time to prepare for anything. Last week, somebody was very okay. This week, the person is really deteriorated on bed and the person is gone. So that one has got, mentally, it has got an impact. So people get depression, people are stressed, and also in a financial or in monetary terms, it is draining because some of the people are the breadwinners.
Yeah.
The other one is that we look at is the stigma. In families where they have been tested positive, they have had that stigma. People have tended to run away from them, saying, if at all I get engaged with them, I will end up also, getting the what? The COVID. So people have stigmatized. And with the stigma, it is it has got a very big impact. You end up being in isolation. You end up being alone. Your friends run away from you. That you are suspected to be what? With the
COVID
to be
patient.
yes, a COVID patient. So if your close friends, all of them leave you, what how will you feel being left alone? Of course, you feel depressed. You feel you are not worthy to live, and now there's no thing that you are going to think of except probably death. That at any time you are going to die. So in that itself, of course, depression, bereavement, you have stigma and so forth, which people have. But longer term effects are there. For example, if there is loss in a family, some of the children may not be able to go back to school because the money is there, the breadwinner has gone, and the monies that they have cannot be able to sustain, first of all, the living, and that one in itself impacts on the health, on the nutritional aspect. Either if there are young children, if there are elderly people in the family, it gives a strain onto that. So longer term effects are also there. It can also be a trigger of psychiatric conditions. For example, if somebody was stable, and now there is a we have bipolar disorders, where we call them the mood disorders. So you may find that at that particular point, that could be a point in somebody's lifetime that the person is now getting the mood disorder, which the person can be with for the rest of his or her life.
Yeah.
Okay.
Thank you so much, Dr. Tim. I would like to first of all go to people who are viewing, who are asking questions. So, Shian Kaziwema been asked a question: what of the presidential candidates who tested? Are they going to be tested again? That's political. Then, basing on the Dr. Tim answered this one, when it came to political, when it comes to communities and also people's lives, how best can they get to know that they are positive or not? Then Namakula said, thank you so much, Dr. Tim, for the insight when it comes to University of African Facebook page. Then for those ones who are watching us, the show has been it's sponsored by today. It has been sponsored by University of Africa Foundation, which is a non-profit organization. They are supporting different countries in Africa in that when it comes to people's health and also giving equipment to support different people, conducting community dialogue, conducting community outreaches, and supporting people when it comes to health. They are focusing mostly on health. And also, we are live on University of Africa Foundation page. You can go on their Facebook page, you can go on their YouTube page, you can go on there, you can go visit their website and read about them. Then you see how best they can easily support your community. Then here on the panel today, we are having Dr. Tim Patrick and also Dr. Kugonza Martin. I want Dr. Martin, like before we had different people saying when you take Jinga, you don't get COVID. When you take warm water, you don't get COVID. When you take very many things that people talked about. How true were these things, or people were just scared and people were just giving false information to people?
Like I say, anything that is said without it being proven, like it's baseless, sorry to say, we would not rely on it quite much. So the fact that everyone is taking Jinga, is taking lemon, they are just a relief of some of the symptoms, like nasal congestion, in case you're steaming yourself, and the herbalists can continuously tell us how virtually they would help, but in the medical point of view, what would really come out when someone says it gives them a bit of relief, that is okay, basing on them, because there are other people who would use them the same remedy, and there is no relief. So once we don't have any fact behind it, we will not take it up easily. Though it is important to know that they are important because they contain micronutrients which are important for our body, zinc. So for example, maybe some vitamins, some minerals, micronutrients basically that suit our bodies. Yes.
Okay, thank you so much, Dr. Martin. Remember yesterday, it was 21st of December, Uganda marked, like, that's when we made the 9 month when we got our first case, which was in March. And now, Dr. Tim, we have very many people who say when you do exercise, you have the chances of getting COVID. When you take hormone, they have the chances of getting COVID. And they have there are those who have started saying that even if when you take alcohol, you may not get COVID, because alcohol, even the sanitizer we use is alcohol. So when you drink alcohol, it kills the virus if it's within you. If you take warm water, you don't get COVID. Like, what are some of the things that we should do, and what are some of the things that we shouldn't do when we are fighting COVID?
All right. Thank you very much for the question. First of all, let me first demystify some of the things. For example, taking alcohol. The percentage of alcohol in 100 mils is about either 15 to 15, 17, maybe up to 40%.
Yeah.
For example, there's this small pack, how do they call it, the toti pack?
The cathode pump.
Yes,
Yeah, smaller.
it's about 40% alcohol. But the sanitizer itself is more than that. It's almost like 70, between 70 to 80% of alcohol, so over 100 mils. So that means what we use as a sanitizer is much more concentrated. It's much more of pure alcohol than the warrage, or these other drinks that people have that contain alcohol in it. The concentration is low. For example, somebody cannot take beer, which is 5.7 or which is 5 percent, and then you say that you have sanitized yourself.
Yeah.
That will be a myth. You actually you'll not be able to be doing yourself a good service. Regular exercises is good. Regular feeding is good. Good nutritional balance is very, very good for the body. However, with all those ones, it cannot stop you from getting the virus. You'll get it, but it will find that your body's immunity is high. I mean, it can be able to handle it can handle, or it can be able to fight off the disease, okay, the COVID-19, a little bit easily than when somebody did not have those exercises, somebody did not feed well, and so forth, okay? Then the best things that what we do in order to prevent the COVID-19, one, they say, please put on your masks. As long as you get into the community, as long as you get into the public, out of your home, please put on your mask. Because at least we know that the closer you are to people out there, you don't know whether they have tested positive or they are negative. So for you to be able to put on your mask at all times when you're out in the public. Two, hand washing and sanitizing. Hand washing wherever you are going, at least they are, according to the SOPs that we have, every facility should have a washing facility at the front before you enter or before you access that facility or before you do anything. So even regular use of a sanitizer is very fine. Then social distancing. At least the SOPs, like people who are seated in taxis, please follow the SOPs. Sit at the extreme sides of those seats. That one is okay, because that is, we do believe with your mask on, with that distance, the risk is reduced. The risk of exposure to the COVID-19 is reduced. So, and then also to be aware of the changes that happen to you. If you have a cough, if you have a flu, if you have something like that, you should have that index of suspicion. Index of suspicion that could this be COVID. But if you ignore it, and then at a later time when you are tested, it might be at a very wrong stage. So those are the basic things that you can be able to do for everybody who is out there. Put on your mask, sanitize, and keep your social distance. Then the other things, feeding well, exercising, those ones can be able to help the body.
Thank you so much, Dr. Tim. Whoever is watching us, just now we are discussing the impact of COVID-19 on post-mental health, and also we are live on YouTube, we are live on Facebook. And today on the panel we have Dr. Tim Patrick and also Dr. Kugonza Martin, both working at China Uganda Fish Hospital, and also they are on the task force of Uganda when it comes to fighting COVID. They have both ever worked in ETU. Then remember, like they say, follow the SOPs, follow what Minister of Health is telling you. If you're going, please, if you're going, you're supposed to go in the village. You know this is Christmas season. You're supposed to visit our friends and families in village areas. Please stay in Kampala. You'll visit them later on because you may take the virus onto them. Then also make sure that you wear a mask every time that you are in two public spaces, and also wash your hands with running water plus soap, and also sanitize, social distance. And also don't forget to subscribe, share, comment, tell us what you think about the topic, and tell us your view about the topic we are discussing. So what would be your last points before we close?
Coronavirus or COVID-19, it's a real disease. It's airborne. It's very infectious and contagious at the same time. I urge you to protect yourself, your family, your loved ones, and everybody else by putting on a mask Could be a fabric mask, could be a medical mask, could be a high-level mask, covering your nose, your mouth, all the time. Practice hand washing, which is hand hygiene, with running water and soap, or a sanitizer, or if you know how to mix jik with water, use that. Keep a social distance. Follow the Ministry of Health guidelines as they indicate, and always be alert and accepting whatever the Ministry of Health guidelines are indicating towards you and all the health workers.
Thank you so much, Dr. Martin. Those have been Dr. Gonza Martin's words. Now, to Dr. Tim, what would be your last words before we close off?
Yes, my last words would be to the general public is that these are challenging times, and they come with different mental health challenges. And whoever is experiencing a challenge, for example, somebody is not able to sleep, somebody has lost just appetite, the person is no longer eating, somebody is depressed, somebody is not able to, actually he sees himself as maybe about to die, or doesn't really, sees the future is bleak or black. Okay, we should be able to seek psychiatric services. Yeah. And in almost all hospitals within the country, at least there are psychiatric teams which are there. And even in COVID centers, for those ones who are positive, there are psychiatric personnel who are there to be able to handle those issues that come with the psychological disturbances. So if somebody is having any challenge psychologically, you should not keep there to yourself. You should be able to come, or you contact either the ministry directly, and you can be referred to a particular place where you can be able to seek the services. But don't be out there with a challenge. The services are there, and you should be able to get them and be provided free of charge. Thank you.
Thank you so much, Dr. Tim. Those have been Dr. Tim's words. And remember, COVID is real. Whoever is watching us, COVID is real. You shouldn't take it for granted. You shouldn't just play around with COVID. It's a serious disease. It's taking people's lives. And I know very many people have been affected by COVID. People have lost their lives. And very many people have lost brothers and sisters, like fathers. So COVID is real. Wash your hands, sanitize, social distance. Know that you may lose your life if you play around with it. Do exercise like they have said. Don't just take whatever medicine that you think that will fight COVID. There's no you can say you have COVID unless when you are tested, like they have all said. Go and test if you want to test. We have different testing points that you can look for those points on social media, like they're all over the place, but just know if they are verified by Ministry of Health. Follow Ministry of Health guidelines. Know what you're supposed to do every time that you are into public. Wear your mask, social distance. US class is there to give you information. For us, we are going to close for festive season. Very soon we are going to be closing. But we'd like to wish everyone a Merry Christmas and Happy New Year 2021. Want 2021 to find you when you are live. You don't want to lose any viewer. Subscribe, give us your comments, share, invite friends on your friends on our Facebook page. And very soon we are going to bring in more things on Facebook, on Face Class, in that you yourself you also be able to participate on different topics. Like we shall be viewing you virtually, like the way you used to do to us. Thank you so much. This show has been powered by University of Africa Foundation. University of Africa Foundation, they tell you they are here to support different countries in Africa by providing different equipments for health workers, and also training health workers, and also giving information which is necessary for the public to know. You can visit them on their Facebook page. You can visit them on their website, and also on their YouTube page, YouTube channel. Then you discuss 5-6 social media show that runs every single day that comes, and we give different information to different kind of people which you want to listen to or you want to view to, and that we sensitize you that you don't fall a victim of any circumstances. Thank you so much for watching this class. Watch us next time. See you. Keep on our Facebook page live.